We'll call our meeting to order this morning. It's good to see everybody out. Welcome everybody this morning. Seems like it's been a long time since I've been here, but anyway, if we would all rise for the Pledge of Allegiance, followed by invocation. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Reverend Tim Jenkins, please. Lead us in invocation.
Heavenly Father, we come to you today thanking you, Lord, for the blessings of life you've given us for another day. Lord, I pray for these commissioners as they've gathered, Lord, in a time that the world is full of chaos and trouble. Lord, I pray help them to not lean to their understanding, but lean to your ways and to your word to guide them, to lead them, to direct them in all the decisions that they make. Lord, that they will call good, good, and evil, evil, instead of things that's going on today. God, help us, Lord, as we all face this world, to walk in your ways, to lean on your word. Give them a special blessing, Lord, to always do what's right. For it is in the name of Jesus we pray. Amen.
Amen. Thank you, sir. One change on the agenda. On the back side, general business. Glade Creek Fire Department won't be here today, so we'll cancel that out.
Motion to approve with the deletion as noted.
Second. Motion to approve and a second. Any discussion? Not all in favor? 4-0. This time we'll open the floor to public comment. If anyone has any comments about the meeting, whatever, just please come forward and state your name. You have 3 minutes to give us a comment.
I'm Al Clifton with Saddle Ridge Property Owners Association. We have 193 lots. And I'm here to speak about the waste landfill fee that's been imposed on us for $98 per lot. And if you do the math on that, that runs $18,000 for the year. I think that's a little much. I'm here on the behalf of the property owners. In the past, we have always paid a landfill fee to the county, which was approximately $1,000 per year. On top of the pickup service, which is $2,500, so we've been normally paying $3,300 for our landfill fees. And this year we got imposed on $18,000, which is like a 2,000% increase. And I'm here to ask that we, to propose that we divide it in half for the year instead of $98 per property to do a $49 fee. I think that's in line with the other counties around us. And I understand that we need an increase sometimes. I don't think we need the 98 per lot. And thank you for your time.
Thank you.
Thank you, sir.
Anyone else have any comments?
Hi, I'm Carolyn Monahan from Saddle Ridge Campground. One of the things, we're just asking for your consideration because we just feel like the fee is just exorbitant. Another thing, we're only there from May until the 1st of November. The campground closes down the 1st of November, water's turned off, so we're only up there 6 months out of the year. And most of the people that live there live within an hour or 2 hours drive, so they only come up for the weekend to get away and get up to where it's cooler weather, of course you can understand. And we're just not there enough. You know, some of us are up there full time, but 6 months out of the year, we just thought that was just a little absorbent for what for that length of time. And we understand the fee. We know why you have it, and we know that there's things to be paid. But just consider lowering it to a smaller amount for us. Thank you.
Thank you, ma'am. Thank you. Anyone else? Seeing none, we'll close the public comment. Move on down to the presentation of the board. NCDOT, Mr. Wayne Adkins, Daniel Adams.
Good morning. I'm Wayne Atkins, and I'm a project development engineer, work out of North Wilkesboro, which Alleghany is one of our 8 counties. Daniel Adams is the division traffic engineer. And as far as presentations, I really thought we was going to be answering questions, but maybe I'll try to answer a few of them first. I guess I'm anticipating the questions are on the speed limits on US 221 and NC 93. A lot of times we get requests to lower speed limits. In this particular case, statewide, we're doing a study trying to do 1,000 miles a year of all our roads that have statutory speed limit, which is 55 if it's unposted. And the reason for that is really safety. So that's why we really studied the 2 roads. And then once they were studied, we look at a lot of things. We look at like accidents, the characteristics of the road. We call it typical section, be like the shoulder widths, heights of fields, or, well, cuts too, but mainly fields. And really these roads have pretty narrow, I call it typical section, but if you look at recovery areas, if you run out of the road. So safety is really a big, one of our big concerns. And I know we're in a mountainous region, terrain and all, and our roads, the typical sections are really pretty narrow. So that, the different characteristics of the road, and we have to look at it as if it's someone unfamiliar with the road. Now, I know there's sections you can drive, us folks that are local, we can drive maybe, we're more comfortable at a faster speed maybe than someone that's unfamiliar with the road. So our signing, when you look at it from a safety perspective, is really, we have to look at it as if it's someone unfamiliar with the road. And if you pull the accidents, some of the accidents are people from, not from our area. So make a long story short, the results of our study was 45-mile-an-hour speed limits. And the real purpose is safety. We even have speed limits anyway. It doesn't mean that's the fastest that anybody could drive the road, but it's the safest speed. Someone unfamiliar with the road should be able to safely drive the road. Any questions from the board on that?
I've got a question. I understand everything you're saying. Safety is always first and foremost.
Right.
I live up on 93, and like every other road, the speed limits ain't been changed, and I don't know how long I had speed limits. I guess it's been 55 all my life.
Right.
And all of a sudden, I understand what you're saying, but we travel that road every day, you know, and the route of the road has never changed. It's still as is. We've all got along great all these years, and there's caution signs on every curve. It's got a recommended speed limit. And I would think the out-of-towners could look at those and drive by those. If I'm in a new place, that's what I do. Personally, I'd like to see it go back 55 mile an hour. That's
Do an engineering study of all the characteristics on the roads, and like I said, really safety is our #1 priority, period. We're trying to study all of our unposted roads. When I say unposted, if it's unposted, the statutory speed limit is 55, whether you can drive it at that or not. And I know there's probably roads off of that But we're studying your primary and higher traffic volume roads first. And I don't know the true number, you may, but I don't know the true number of miles of roads that we have that are unposted statewide. But we're trying to address the primary roads and the higher volume secondary roads first. I imagine we'll, continue to pretty much address all the unposted roads. These two are both primary roads, and like I said, the safety is our concern, and want to the and all. Based on the criteria and all we go by, we really should post them 45.
I understand. I'm a private pilot. I've lived by rules all my life in the Marine Corps and everywhere else. And I can see the justification that the state has for lowering the speed limit. Driven these roads since I was 16. The only danger right now is me running up on somebody at 70 miles an hour and them doing 35. Fine, I'm illegal. I'm speeding. They don't know the roads. But what galls me, where's the plan to widen and straighten these roads that you are telling us that you have got to reduce the speed limit because they're unsafe? Now, you've admitted they're unsafe. Where is this poor old county, and we're not going to get anything, I realize that. We got less than 11,000 people in this county, to a politician that votes. One district in Wilkes County has more than every registered voter in Alleghany County. But if you're going to come up here and you're going to dictate this to us, then give us some consideration for road improvement, please. And I know I'm preaching to a guy that works for a guy down in Raleigh, but please pass it up the line. Safety reasons, fine, right, but help mitigate the safety.
We're not saying the road is unsafe, but the speed limit should be 45 to really make it where a normal, prudent driver shouldn't have a problem. So I'm not really saying it's unsafe. Now, as far as projects, we have a system. I know Alleghany belongs to the, I believe it's the High Country RPO. Isn't that correct? Okay. The way our projects are programmed anymore, and that's any road. Now, years ago, we had a secondary road fund that we could address secondary roads, whether it be unpaved, paving of unpaved roads, but we also did improvements, widening. Now, that fund was strictly secondary road. We don't have that anymore. At one time, we used to get more money in Alleghany County than is earmarked for the statewide, as far as improvements to secondary roads. Matter of fact, well, I know we got more. That was a good program. I was a district engineer, had Alleghany County at that time. Counties, Alleghany, Surrey, and Yadkin. I worked out of Elkin at that time. It's honestly is one of the best programs that through my career that I've ever been involved with was the secondary road paving program. But we did widen roads too. But today, excuse me, the way projects come to being, if you will, is you would go through the RPO and ask for projects, if you will, regardless of what. 93 would be a good one. Let me give you an example. R4060, which is done now, but it would be the new part that goes through actually our DOT complex. Goes from 21 out to Grandview. Sparta Parkway, it was the last leg of it. That came to being through the statewide transportation improvement program. Any projects today, like for the scope of what we're talking about, widening of say 93 or 221, when I say widening, improving, whether it be straightening, horizontally, vertically, you know, those kind of projects are addressed through our, we call it STIP, but it's the State Transportation Improvement Program. The way you get projects in that is really you go through the RPO and ask for projects, and then they would submit projects for Alleghany, but all the different counties that are, belong to that RPO. Projects are scored based on safety, accidents. It's just the process to get a project. Questions on that part of the process?
I've got several questions, and I like the way that you started out with your presentation. You say safety is paramount. I'm like John, and I think the rest of us, is safety is supposedly your concerns, then why not widen the road? Why not straighten the road? Not on just 93, but also you've put these restrictions for a good part of 21. I live off of 21. There's 2 short passing lanes on 21 between here and 113. And you've taken away both of those passing lanes by dropping the speed limit to 45. Now, if you come down what I call Spicer Hill and you just coast, you're doing more than 45 when you get down to Tom Atwood's house, and that's just coasting, and that's a straight road. We've driven these roads more years than I can remember at 55, and then all of a sudden, one morning, the speed limit's 55 when I come to town. That afternoon when I come back, miraculously, all these 45 signs pop up. The road banks are not mowed. You can't read half the signs, but yet somehow you had time to put up these 45-mile-an-hour speed limit signs. I want to know what would be the process to get it changed back the way that it should be. Another thing I'd like to know is why we can't get a nighttime meeting out of DOT. When we had the first meeting, that was what the public wanted, that's what the board wanted, was a nighttime meeting. And for some reason, DOT couldn't do it. And I still think you need to come one time at nighttime and let the public speak if they want to. And I would like to see somebody that's above your level attend that meeting and try to explain why we're being punished down to 45 miles an hour when almost everybody who drives these roads have driven them for the last 50, 60, 70 years at 55. And when you come to a curve and you know you're not going to be doing 55, those people slow down. So I think part of what you're saying, you're penalizing us for tourists coming to this county who don't know the road. Now, that doesn't make sense to me. Again, I'd like to know if it can be changed and what would the process, what we have to do to get it put back the way that it should be.
You're asking us, we can re-review, but in all honesty, the criteria we go by, which is geared more towards safety, not punishment. We're not trying to punish anybody. We're just trying to make the roads as safe as possible. And so the 45 is really the speed limit that should be appropriate. Now, I can tell you about a road that's a 4-lane road that's a 50-mile-an-hour speed limit. It's a mountainous road. It goes up or down a mountain depending on which way you go in a different county. And we've had complaints about it. However, it's the appropriate speed, and when you look at safety and accidents, it's still 50. Now, you're asking, I'm not saying we won't re-look at it, we will. I don't know that we'd be able to raise it, but we'll look at it, I will tell you that. Now, as far as a night meeting, the emails I was aware of, which I report to Mike Pettyjohn. He's our division engineer, and he would be the next in line, if you will. He couldn't attend the dates that you gave as far as a night meeting, and as far as I knew, this meeting was acceptable, and he couldn't be here. He asked me if I could come, which Daniel and I are here. I'm not aware of anybody refusing to have a night meeting, and we're not going to refuse. As far as I knew, this was an acceptable time. I don't know what else to say other than I thought it was okay.
It was
So-
acceptable because it was the only meeting we could get with you. The board still, and I believe all the board members still, had wanted the nighttime meeting. And the emails that we got back from DOT, that nighttime meeting wouldn't fit the schedule or, whatever the reason was. But the only reason, we don't want to let this thing die. That's why there's another meeting today, and I would still like to have the nighttime meeting, so where the general public has a chance, if they want to attend that meeting and ask questions.
I'll pass that on. The only emails that I actually had direct was confirming that we would be here. Didn't know it was a concern or a problem, being honest with you. So we're not going to refuse to have to meet with you.
Commissioner Michelle?
First of all, thanks for coming to both of you. I, like everybody else, understand the safety concerns, but why not do a compromise like recommended speed instead of, that it is required to be 45? Because, like they said, we are used to driving these roads and I penalize the people who have driven it for that speed for years. And again, a meeting at night is called for, and I would implore that Mr. Pettyjohn attend that meeting. I wanted to ask why you didn't go by the 85% rule, or did you? The National Motorists Association said that speed limits should be based on sound traffic engineering principles that consider responsible motorists' actual travel speeds. Typically, this should result in speed limits set at the 85th percentile speed of free-flowing traffic. These limits should be adjusted to reflect changes. So, and actually it says here that slower isn't always safer. There's actually more accidents when the rates are lower. So I wanted to bring that up. That's what Miss Tanya Alisse sent to me. She was here last meeting. She's very upset. She lives out in that area. She was unable to be here because it's not a night meeting. So, instead of doing this, we need to look at the bypass. There's wrecks continually happening on the bypass. I mean, very serious wrecks. And, people are upset. You work for us, the taxpayer, just like, we work for the taxpayer too, and that's why we're bringing this up now. So.
You have concerns. The 85th percentile is one of the criteria. It's not the only criteria, being honest. It is one of.
It's just certainly hard to understand from everybody living local. The road design's not changed. And honestly, I feel like 93 is safer today than it's been for one reason. A lot of guardrails been added up through there in the past several years, and that really helps the wintertime black ice situation where you have so many fender benders.
Honestly, the guardrail, we have I call it a project as such, but it addresses different roads. And we don't have the funding to install guardrail like we'd like to, but we do have that as a project in the STIP. Other ways that you can get guardrail, if it's a real high accident area, we can sometimes get safety funds, but we are addressing through the STIP a lot of guardrails, and that is funded in the STIP. Try to keep that in from a safety perspective. And it is honestly, it is a good program. We're still limited in funds. Personally, I would like to improve all our primary roads that haven't been. But the funding is not there, and the way we do that, I'm sort of repeating, and I apologize for that, but is to get the projects submitted into the STIP. It's true in any county, it doesn't matter where.
The bypass needs to be worked on immediately because there is just wreck after wreck after wreck there. And we're just going to.
Where are they happening at?
Mainly at the Grandview crossing because not enough signage up.
We have improved the signage and added, and no, Grandview was a through road my whole career until we built that part of the parkways. Our records show that there was only 2 accidents, I believe, at that intersection. It was opened.
No.
Now,
No,
the way, what we do, all I can say is what the records that we pull. Now, I know it's within municipal limits, and if the police, they need to report our state folks any accidents, right?
Yeah.
That's how we know.
They entered into the DMV database. The database that we're.
So they want to, and we can ask them too if they're reporting the accidents. When we pulled it, we only saw 2, right?
Yep.
I'm not saying you're wrong, but if they're not reported to the DMV and if they're reported, they would be entered into that. Now, I will be on it, and I'm not talking about Sparta, but I know sometimes the municipalities don't always report them, and they don't always do it timely. Well, I'm not saying they're all reported. All we could see was 2. I'm not saying you're wrong, so I'm saying that.
Go through there all the time. There's constantly in the Alleghany News front page picture of a wreck on Grandview and Sparta Parkway.
All we could do, sorry, but it's something with the, certainly you can't get that wrong. But
Other questions?
I have a comment. Thank you for coming. Thank you for your honesty, but empathize with you. The state of North Carolina, we're in a heck of a situation, to be honest with you. You don't believe it. Getting rush hour traffic around Charlotte. I used to work in Charleston. It would take me longer to get through Charlotte than it would from Charlotte to Charleston. It's ridiculous, and that is a major thoroughfare. We realize that we're just a pimple on an elephant's behind, but up here, those of us that grew up around here, we're used to this. It's just galling. That's all. Bless you, and thank you for coming, and thank you for your honesty.
Can I make one other?
Go ahead.
The STIP has 3 basic parts to it as far as the projects. One is, which you mentioned, the Charlotte area, is statewide, and that basically is your interstate and roads that connect. And regional area. As a division, there's 14 highway divisions in the state. We are number 11. That's not a priority. That's just they start on the east and they come this way, and we're the 11th. And then there's division needs. So the projects are submitted, generally speaking, for us, we're pretty rural as a division. And they usually not usually, but as far as the funding, two divisions are paired together. The 12th division is, from a funding standpoint, in the STIP, and 11 and 12 are paired together. And in our part, but there's three criteria. You got the statewide, regional, and then division. And for us, we don't get a lot of statewide because we're so rural. I'm just on it like it is. STIP funding is based on population as well as miles, so there's a couple of different ways. A lot of our projects are going to be either regional or division. But I would encourage you through the RPO to submit like 93, 221, I'm not trying to limit, and do a priority in your submission. And then it's, as far as the RPO would do a total of every county that's involved, and y'all would have some voting power, you know. Get them prioritized and submit them in the STIP. I would encourage, I think y'all are active at the RPO, and that's good, and I like that. That's the way we get projects funded, generally speaking.
Well, we appreciate you guys coming up, been very kind and patient with us, and we certainly appreciate that.
Appreciate y'all being nice to us. We recognize your concerns, and I will talk to Mr. Pettyjohn about a night meeting.
Work on that.
Of trying to pace the buck here, but if I could come, I did acknowledge. I'm not going to refuse to meet with you. I will tell you that. On a different.
We appreciate it.
Thank y'all for your time. We appreciate it.
Oh,
Is there anything else? If not, we'll.
I think we're done.
That's okay.
Appreciate it.
Thank you very much.
Thank you.
Have a great
Do.
day. Safe traveling.
Next will be the Health Department update. Ms. Jennifer Green. Mr. Randy Bleetham.
Morning.
Morning.
Ask Ms. Todd if she would mind to drive my slides. I think if you go slideshow, or yeah, you. I'm here with Andy, and we're going to start with a little bit of a COVID update, and thank you for inviting us to come. Appreciate that. And then we'll talk about environmental health and our permitting process. So you can go to the next slide. I wanted to say, I know that the public, along with all the healthcare, public health, or anybody who does a health career, staff, and many of all of us, for personal reasons, are very tired of COVID. We're tired of talking about COVID. I want to say I'm in that camp. Count me in. And we're not done yet. We had a nice little bit of a dip in cases over the summer, and we're hopeful to get back to that area. So I'm going to talk to you a little bit about what we're seeing right now, but I do want to just acknowledge the fact that I know folks have pandemic fatigue, us too. So let's keep working together. Obviously, the Delta variant has certainly thrown a big challenge before us, and hopefully we're getting to the end of what we're seeing with that right now. If you go to the next slide. So this is a graph that will show you the number of active cases, and I realize you may not be able to see all the detail here. I did want to point out, every week we publish a report. It's a weekly situation update. This graph is included as well as, sorry, I'll get it out in a minute, as well as many other graphs that I'm going to show you today are included in our weekly reports. But this will show you by color, by age group. So the intent of this is to show you, if you look at the bars and you head from the left to the right, you can see the beginning is mid-July, late July, and then the last week is September 5th through the 11th. So the important part here is that it's showing growth in all age groups, right? And the important part here that's also important is we know we need to get more people vaccinated to protect ourselves from more spread of the virus. And that's why we're continuing to see lots of cases. We also know the Delta variant is more than twice as contagious as the original COVID. So yes, we've seen a lot of growth in COVID. Part of the reason we're asking people to wear masks is because we know that there can be spread even among vaccinated people, although the vaccines are definitely showing that they are working very well to prevent severe hospitalization and death. So if you go to the next slide, this will show you our tests administered in the blue bars, and the red line shows you our percent positivity. And you can see we've had some shifts up and down, and obviously we know that the amount of testing that we're doing definitely influences that number. So we recognize that, but we're still well above 5%, which is really what we want to be. And if you look again back in that July timeframe, we know that we're not going to have a zero probably, but if we can take it back to that earlier threshold, that's really what we're aiming for. If you go to the next slide. This is a graph that shows you hospitalizations for the region. We don't have county by county or hospital by hospital data. That's not how it's reported, but I can tell you the promising news is that we're starting to see that line, that blue line, sort of level off. And I hope that that's going to continue, that we don't continue to see it rise, which is what we've seen. The challenge with hospitalizations is not just COVID, but when our hospitals all around us are all full of COVID response, it makes it harder for them to support lots of other healthcare needs. So someone has a stroke, a heart attack, a car accident, or other needs, it limits their ability because they typically work together. So I want to be careful I don't get too far out of my lane, but I will say it's been a strain on healthcare in general, including our hospitals, and that's why we include this in our weekly update. Go to the next slide. So these are 4 key metrics. This is from the state epidemiologist, Dr. Zach Moore, and this is going back to the beginning of September. So this is what we've been seeing for some time. The far upper left shows you hospitalization, so you can see how that curve is going up. If you go down to the bottom left, that's our daily cases reported for the state. And again, you can see if you look back to December, January timeframe, that's when we were seeing peaks in cases. So we were heading right back up to that area, except much faster than we had in previous times. The purple in the upper right shows you the percent of positive tests, and really the fact that it's been high for some time now, at least through August. And then the bottom right is COVID-like illness visits to the emergency room, and the red line is what we watch on that graph. The promising news here, if you look at the very tip of the red line, it's sort of looking like it's leveling off versus continuing to climb up. So that's a positive piece of information, and we're going to have to continue to watch that. But that's often one of our indicators. And when we see all 4 of these on the rise, that's when we're obviously very concerned, because deaths usually follow this. Okay, if you go to the next slide. So this will show you case rates across all age groups. What I'll point out here that's positive news, the blue line is the 65 and older population, and yes, it's going up just like all the other age groups, but what we've seen that's positive is that it's not going up to the same impact that it was previously, and in fact, it's one of the lower numbers here. And the reason we believe is because we have a higher percentage of people in that population group that are vaccinated, and this is a statewide data. So if you go to the next one, we have continued to see racial differences, and I just put that in here because I think that's always important for us to consider. If you go to the next slide. We have seen some gap widening between Hispanic and non-Hispanic, and I put this here because I often get questions about farm workers, so I'm going to come back to that in a minute. If you go to the next slide. This is showing you the variance in North Carolina. There is genomic surveillance happening at the state lab and other private labs when we have COVID samples submitted. And so you can see here in the red bars, that's when we started to see more of the Delta variant. And obviously, that's what we believe has driven a lot of the case increases that we've seen. I mentioned this before, but just because I wanted to make sure everyone heard me, it's more than twice as infectious or contagious as the original COVID that we had. Okay, if you go to the next slide. Okay, so the positive news here, hope you're picking up a theme. I'm trying to pull out the bright spots here, is that we're moving in the right direction. We're seeing more people get vaccinated, and we've seen a slow inching up of percentage of our population that are vaccinated. That is what we know is going to get us to the other side so that COVID is not a constant disruptor in our lives. So we're at 55% of our population who is at least fully or partially vaccinated. And I'll just point out the age graph on the very bottom right, which shows you that in their older populations, we're doing pretty well. A lot of folks have gotten their vaccine, and we really think that's good. We have a 70% interim goal because we believe that that is the goal that we need to at least hit to slow things down dramatically. We could see that that goal gets risen over time, but at least getting to 70% is what our interim goal is. So you can see by age group how much room we have to grow with our 12 to 17 population, 18 to 24, and 25 to 49. We've got some ways to go. And of course, this doesn't include children who are under 12. We are still waiting for the FDA to give approval of that after the manufacturers submit their data. We know that's coming probably this winter, but we don't have that yet. And then the top right, I wanted to point out, I often get asked about farm workers and our Hispanic population and how we're doing there with access to vaccines. And I'll just say we're actually doing better in that population than we are in our non-Hispanic population. And I believe that a lot of that is due to the partnerships we've had, good county collaboration and farmers who are trying to make sure that their workers get access to a vaccine if they want one. Okay, you can go to the next slide. So this is one of the most important slides that I'll point out. I often get asked, why are we making such a big deal about COVID? We know a lot of people have mild illness. Yes, that's true. But if you look at this gives you a little point to remember. In 16 months, North Carolina lost over 14,000 people due to COVID. And in 10 years, they lost 1,275 people to flu. So that's why, because there's two different viruses. Yes, we are all wanting it to go away. Again, I'll just say that again because I want everyone to know that. But it's why we care so much, because it has affected our population at a much higher rate. Okay, you can go to the next slide. Okay, and I'll just point this out too. This is a statewide snapshot of death trends. Unfortunately, we have seen deaths in younger age groups. Thankfully, we haven't seen any young deaths here locally, and I'm glad for that. Even in the 0% category, you can see that there have been deaths in 5 to 9-year-olds, 15 to 17-year-olds, and 18 to 24-year-olds, not to mention adults. I will say again, one of the most important things is that we're seeing the folks who are having the most severe illness are people who are not vaccinated yet. They haven't chosen to be vaccinated, and we understand that there are a lot of questions around the vaccine, but that's what we're seeing is folks who are having a harder time are those who are not vaccinated. Okay, if you go to the next slide. This slide shows you some data from North Carolina specifically, and I thought it was helpful. You're 4.5 times more likely to get COVID if you are not vaccinated. If you go to the next slide. And unfortunately, the COVID death rate or mortality rate, if you are not vaccinated, you're more than 15 times more likely to die from COVID. So that's why, again, we are trying to continue to say, like a broken record, please get vaccinated. Okay, go to the next slide. This is important too. I've been asked, why do I care about getting a vaccine if I've already had COVID? Won't my immunity last? Yes, for a little while, but we know that at least from some studies, you're still over twice as likely to get COVID again. We have had people who have gotten COVID once, gotten better. In 3 months, they get it again. And I'll just remind you, we have a different version of COVID right now. It's more contagious. So you're not necessarily safe because you've had COVID previously. Okay, you go to the next slide. We know that right now, Pfizer has a full FDA approval for age 16 and older, and that is a vaccine that's eligible for anyone who is 12 and up. And we do have that at the health department, if you go to the next slide. And this just shows you a little bit more about Moderna and Johnson & Johnson. There's continued work to try to evaluate the data that they've submitted to get the full approval for those vaccines as well. It's just a timing issue, I think, but we'll see that happen soon. 5 to 11-year-olds is what we're looking at next, and that's probably going to come this winter. Could be late November, could be December, might be January, somewhere around late fall, early winter time. Okay, if you go to the next slide. I wanted to mention this because we've seen this happen. There's been a health alert network gone out to all providers in North Carolina from our state health director, and there's been a CDC health advisory alert. Ivermectin has not been proven to treat COVID, and in fact has sent a lot of people to the hospital. People have died, and we have seen an increase in North Carolina poison control calls. So I just want to make sure everybody knows ivermectin is not something you should be trying to take to treat COVID. We understand a lot of times we're excited about a quick fix, but this is not it. So please don't use that. Okay, you can go to the next slide. I wanted to mention monoclonal antibodies because we're happy to have a treatment available, and I know our local hospital has been working very hard to make this available for folks as well as other providers. This is a good thing, but I will just add, it is not a quick fix. It's not an automatic fix. You have to meet certain criteria to be able to get a monoclonal antibody. You've got to be at higher risk, and you have to be early in your illness onset. So just because you've got COVID does not mean you necessarily will get this monoclonal antibodies. And I will say there's been such an uptick in interest in this treatment that the change last week was announced in how the federal government is going to basically spread the supply out across the country. So the state has got to order it and basically assign different amounts in different areas. So the way that providers have been accessing it pretty readily is changed, and it's going to be a little bit bumpy. I'll just use air quotes there, but in trying to get people access to that. I'm not saying that it's not going to be available, but it's going to be probably strictly adhered to people who are at higher risk. Okay, if you go to the next slide. I wanted to mention additional doses or third doses. If you've gotten the Pfizer or Moderna vaccine and you are severely immunocompromised, meaning you have had an organ transplant, you're on immune suppressing medication, you are undergoing cancer treatment, or any other reason that your doctor believes that you need a third dose, those are available now at local pharmacies. We also have them at the health department. And we ask for you to just attest that you meet the criteria. You don't have to bring copies of your medical record. You don't have to have a doctor's note. It's mainly to provide that. And it's just for people with Pfizer or Moderna because we're still waiting on information about another dose for Johnson & Johnson vaccine. But I think that's coming before too much longer. Okay, if you go to the next slide. Booster vaccines, I just want to say, I know it's frustrating because we hear like 1 minute it's going to be this, another minute it's going to be that. I'll just say again, we're with you on that in terms of trying to find timelines. But where we are today with booster vaccines is that we have had the committee recommend to the FDA to approve anyone 65 and older or anyone who's had high risk of severe illness for COVID get a booster vaccine. And the only manufacturer that has submitted information to give that next step of approval process is Pfizer. So if you've gotten the Pfizer vaccine, you're 65 or older, or you have high risk of severe illness, just stand by because we are waiting on the next step, which is the CDC and the Advisory Committee for Immunization to tell us, okay, here's the clinical guidelines that you must follow when you give this vaccine, go. And the next meeting is September 22nd. So I know everybody heard September 20th, but that's part of what we are waiting for as the next step. So we don't have these available at the health department today, but we will as soon as we are able to get that next step. Again, I want to say Moderna and Johnson & Johnson, we're still waiting on more data, and I expect that in the next few weeks we'll probably get some more guidance about them as well. Okay, if you go to the next slide. We currently offer testing every day at the health department. I'm sorry in advance for the traffic jams that we are causing. We've put some more folks outside to route people, so that I think it's a little bit better than it was. But we are offering free testing, 8:30 to 10. We offer rapid tests and PCR tests. And we also offer vaccines 1 to 4 every day. We are also trying to do some mobile vaccine clinics, and I'll just tell you, we're trying to staff up as quickly as we can for that, in addition to all the contact tracing that we're doing right now. Okay, if you go to the next slide, now we're to environmental health. So I'm going to pause there and say, do you have any questions about COVID? Do you want me to just roll on through, or you want to stop here for a second?
Questions from anybody? Oh,
I'm just
take a
as
breath.
confused as ever.
Okay, well, if you think of a question at the end, be glad to take it. So I have Andy here, and we're going to talk a little bit about environmental health. So if you go to the next slide, wanted to just say this is Registered Environmental Health Specialist Week. There's 2,204, I think, or something like that across the state. Not enough people in the REHS field, but I did want to point out that it is the beginning of that week, and we wanted to recognize the staff who worked so hard to do this service and have a special certification they have to obtain to do it. Okay, if you go to the next slide. These are all the services that our environmental health specialists do: septic and well, food and lodging, you know about that, public swimming pools, tattoo parlors, migrant housing. We also consult with meth labs if there is a cleanup needed, and rabies and other needs. That's all required. Okay, if you go to the next slide. I did want to point out, we know that our wait times are longer than they need to be. Our goal has been 2-week turnaround, and it's been that way for a long time. But we have seen an incredible increase in, and this is a good thing. It means people are, there's community growth happening. But if you go back, this graph will show you the applications we've received from calendar year 2018 to the current year in August. So we've already hit 93% of last year's number at the end of August. And since from 2018 to 2020, we saw 66% growth in our applications that were submitted. During that time, we've certainly tried to make sure we are maintaining staff. You all probably know Joe Holder is our lead staff member here, and he has got a lot of experience, which helps him be more efficient, and he has a greater sense of expertise, I think, than a lot of our staff because he's been doing it so long. I'm going to let Andy talk here in a minute, but I did want to point that out. Okay, if you go to the next slide. These are permits issued. So the first one was applications. This is permits that we've issued. So if you look at this number too, again, we've already hit 86% of the total annual permits that we've issued last year by the end of August this year. And we've seen an increase of 40% of the permits issued from the beginning. And sometimes it's going to depend on the different situations as to permit issuance timing. But Andy, if you want to go to the next slide. I did want to say, Andy has been sitting on this work group, so you come on up here and talk.
So the backlog that we're talking about is a statewide issue. There's not any one county, with the exception of maybe one, that is primarily served by municipal wastewater that I know that is anywhere near a 2-week turnaround time. And it's basically supply and demand. The demand for real estate transactions, whether it be raw land, undeveloped land, or existing houses that are needing an update or even repairing old systems that are constantly failing. So this is not anything pertinent to App Health, our district, or this region of the state. And it's extending into other states, Tennessee, Virginia, they're all having the same. So it is a hot topic because obviously economics is a driver, and real estate and tourism in our neck of the woods, if you will, it's the economic end. The state is looking at a number of ways to try to, so the basic need is for more environmental health specialists. Local health departments still provide roughly 94% of the septic permits issued in the state. There's some private options that I can talk about a little later if you would like. But by and large, local health departments still are supplying that need to an extent. So we're looking at trying to get new staff into a field that is shrinking. The number of new college graduates in the environmental health programs from Western Carolina, East Carolina, and East Tennessee State, which are all pretty close, those students are not coming into environmental health as far as at the local level looking to do septic and well or food and lodging inspections. We also have a lot of turnover. We have a lot of staff that come in for a couple years and then leave, either to pursue higher education, or they're just not up to the stress and the strain that this job entails. So at the state level, the state and counties, Health Directors Association, Environmental Health Supervisors Association, we're all working together to try to look at this, how to get and retain people into this field. As Jennifer alluded to, there are some educational requirements to become a registered environmental health specialist. A 4-year degree with a minimum of 30 hours of approved science. Environmental health is heavy in science because that's how we control communicable diseases. And so looking at some of these requirements and can we work on maybe lessening some of those, the number of hours or possibly an associate's degree, some sort of educational track that will get people trained and in the field quicker. We're also looking at retention. What can it take to keep people in this field? Because in the last 5 or 6 years, I'll have to redo the numbers, but I think we've hired approximately 13 people and lost roughly half of them within 2.5 years. We just lost our last specialist after about 1 year in Watauga County. Decided to go back to college. So it is something.
I'll just jump in here and say, every week I meet with our regional from Faith, Yadkin, Wilkes, Surrey, all of our surrounding areas, and it's a pain point we have all pointed out, which is why they've created this work group to address the issues, because what's happening is we're competing with ourselves. We're out competing our own departments. Last week, Andy sent me a posting for an environmental health specialist. Sign-on bonus was $15,000. And so what's happening is we're seeing that instead of adding enough workforce to the volume, it's creating this cycle of problems because we're just moving people from one place to another. We've had people try to poach our own staff. And I mean, I think that is number one. They've got to work at how do we get people not only trained and in the field, how do we keep them there, but how do we onboard them and get them going faster? If I hire a nurse tomorrow and she starts work next week, that nurse can start being a nurse, right? If I hire an environmental health staff member, unless they have this certification and they've been approved, it takes how long, Andy?
Not to a year.
So that's the part that I think not everybody fully understands, and that's not because we make those rules. That's a state rule, and that's an issue that I think needs to be addressed because it's causing this bottleneck across the whole state, which is not helping us because then the staff who are left feel this enormous amount of pressure. I did want to say, if you want to go to the next slide, Drew, I wanted to point out the things that we have been doing, and we realized that we were starting to get behind in the fall. We don't want to see us get behind. I just want the public to know that it is not our goal. We want to be able to be efficient and effective. We added office positions. We added water protection positions. We actually recruited somebody who already was authorized from another county. We restructured our environmental health staffing so that we could give our current staff more support. I know Andy would never tell you, but he works often, every night, every weekend, doing extra things. The Board of Health authorized overtime for our staff in May because we knew that we were going to get further behind. We have had jobs posted for months now, not able to recruit them because we aren't paying the rate, because remember what I said, so we've just done, we've asked the Board of Health to reevaluate our pay plan and starting pay to try to raise things up. We're going to continue to do overtime to basically encourage our staff to pick up those extra permits that they can do after work and on the weekend. So try to keep ahead of it as best we can, and then just keep supporting the current staff we have. If they aren't supported, they won't stay in it. The folks who are coming into the field, they have enough science. They could go to medical school. We had one go be a physical therapist. I mean, they're going to do other things because they've had the education to be able to do that. It does take a lot to become an REHS, and that's a good thing. We want them to know what they're doing. It's to protect the public's health. But it's an ongoing challenge. I don't know if I have another slide. Maybe I do. Yes. I wanted to make sure you all knew that there are private permitting options available, and I'll let Andy talk about that a little.
There are a number of private option permits that have come about since about 2018 through the legislature. The engineered option permit and this is what they're called, the Session Law 2020-97 LSS COVID option are two mechanisms whereby either a professional engineer who would also work with a licensed soil scientist to evaluate the soils, or a licensed soil scientist can basically do the site evaluation, system design, and the permitting for the most part for a new septic system. With those two options, the only health department involvement is that we are still the official record keeper for the public record. So the engineer, the LSS, submits those plans and specifications to our office. We basically do a in-office paperwork review, make sure that their check sheet is complete, that they've provided all the information required under the general statutes and the rules, and that the system can be put in and expected to function. Then we issue a certificate that allows the owner to get a building permit. It tells the building department that they've got an approved wastewater system, just as if they got a permit from us. So there's very, very little input from the health department. Now, we still permit the drinking water wells and connecting onto existing wells. These two session laws do not give the private sector that. So people would still apply to us if they wanted to drill a new well or connect onto an existing. The third option is the Session Law 2018. This is a hybrid permitting venue whereby a licensed soil scientist would go out and do all the work that they or we would normally do. They would submit to our office the packet with the soils work and the system type and design. We would then look at the design of the system only. We would not go out and evaluate the soils. When we were comfortable that the design is appropriate and will meet code, then our office then takes over, issues the permits, follows through with the field inspections until the operation permit is issued. So it is a hybrid. We share joint liability and responsibility with the licensed soil scientist. There is one other that has been around for a while, but that's where a licensed soil scientist would submit a proposal and we would do a complete review on it, soils and system design, but that's because they have no liability in it. If our department goes out and looks at this normal type proposal, feels that the soils and the system will meet the rules, then we assume the permitting, all the inspections, and all the liability. These options are becoming more, we're seeing more and more of them. However, the private sector has the same problem we do. Not enough licensed soil scientists, not enough engineers to meet the demand. And let me be clear that the demand we're seeing since last fall is it's crazy. This is not normal conditions. Haven't seen this since back in 2005 through 7, when we were just as far behind with even more staff. So a lot of this is due to the current demands. It's just way up here.
Well, and I want to add too, thank you for the funding that the county has given the health department. We have to make sure that when this slows down eventually, because it will, we maintain the staff we have, because we get $0 from the state for this program, none. So it's state rules, and we have to implement them, but we don't get any money from the state to do this program, to have these implemented. So the funds we get from you, the fees that we charge, that's what helps offset the cost of the staff that are working. And when things slow down, we're going to have to make sure we don't suddenly cut our staff, because then when things pick up again, we'll be right back in the same boat. So I just want to say, we know this is a frustrating point. It is not our goal to slow down. We also know that, incredible, but our staff are doing everything that they possibly can. If you have other ideas, please let me know. I mean, last week, I was telling Andy, we had a state health directors meeting, and one of the things that I saw was a job description, and asked for, further review. Like, how do we look at this workforce issue? Because it is not just a county thing. It is every county. All of them are. So it tells me that they need. We're getting people to work so that they can be full. And then also, how do we keep them there? How do we have enough so that they're not strain and stress that they leave?
Appreciate the additional funding that and support we've received from our 3 counties. We're hopeful that with the Board of Health giving us a little more leeway in trying to recruit experienced REHSs, that's where we're going to make some ground, is if we can get people in that only takes about a month or so. If they switch regions, soils vary from the coast to the mountains, but if they've already been through the centralized training, they've been authorized previously, if we can get those types of people to come up, then we can get the turnaround on the staff experience and get them authorized with us and up and running quicker. So fingers crossed.
Any questions? Bobby?
You talk about the training, the education is, and I don't remember the exact number of hours, but is it at a university level? Is it at a community college level? Is there a combination?
You have to have a 4-year university degree, and it has to be 30 years of science. It has to be physical or biological sciences. I would speak more to that.
And when how many trips do you have to make to get the final approval for a septic system, well system? The paperwork, sort of take us through the steps, filling out the paperwork, then the final approval. Sometimes you go to a job site, you think they're supposed to be ready, but they're not. You have to come back. The weather sometimes affects your trips.
So there's a lot of factors involved. So this process starts when the public fills out an application telling us what they would like. Are they looking for a new septic system? Are they looking to expand their current 3-bedroom house up to a 4? Do they want to drill a well? Are they building a deck or an outbuilding? Anything that's going to impact the well and septic on that property. When we receive the application, our front office review it to make sure it's complete. We talk with the public, make sure that they understand that there's some certain site preparations that are critical to have done, so that when our staff go out, they can get right to the job. So when we make that initial site visit, we will take note. Okay, if the property lines are not clearly and accurately marked, and we don't know that we're on the property at hand, then that we have to stop work, because I cannot issue I could issue a permit on the neighbor's land, but that would not go very well. And that has happened before. if we request test holes to be dug, we try to meet people with a machine to dig them, and we've moved towards that over the last 5 or 6 years, and it works very well. But there's still some people that will dig them ahead of time. In the winter months, that can be risky, because if you get 3 or 4 weeks of severe winter weather, whether it be snow and ice or freeze and thaw, those holes can slough and fill in, and we need to clean them back out. If we get out and the house site is not staked, or if the area that we're trying to evaluate for the septic is bullbriars and multifloral rows this high, we can't get in to do the job. So site preparation on the part of the applicant is the biggest factor for that initial trip. Now, every piece of property is different. Soils, or lack of it, can change within a matter of feet. That's why we have moved to digging larger test pits to get a better representation of the soil that we're going to be permitting a system in. And so we can go out and do an evaluation. If that area is not suitable, then we need to find another area. If the holes have been pre-dug for us and those aren't going to work, we ask our staff to try to take their hand augers, find other areas to investigate, assuming they have the time, because they've got multiple stops scheduled every day. Or we'll contact the applicant and say, well, these holes didn't work, we need to dig more and get that on the schedule. Some stops can take less than 20 minutes. If somebody's building a garage and we have all the permits from their septic and well and everything meets setbacks, that's easy. If we get on a new site evaluation on a piece of property, sometimes the soils are great, there's plenty of room, within an hour, we're done. And then staff can move on to paperwork. If it's a challenging site, we've got a lot of rock, we've got soil wetness conditions, people may not have this flexibility of moving houses and driveways around, and we have to start looking at more technical and advanced systems, then that can require additional trips. It could require that a licensed soil scientist, either a private or from the state. We have access to engineers and LSSs that we bring out at no charge to the public on these challenging sites. A lot of them have 15 to 25 counties, so it's not like we can get them out the next day. We wait a lot. We're not the only people backed up in real estate. The attorneys, the surveyors, for one, I think are more backed up than we are. So if we need a property line marked to know that we can fit this system on the right piece of property, or if they're getting an easement from their neighbor, that easement has to be delineated in the field so we know that the system will be encompassed by it. That can take time. So anticipating a wait time is the hardest thing of my job. How long is it going to take, Andy, for us to get out there and do it? Every day is different. We don't know when final inspections are called in. 8 to 9, 9:30, you could have a well planned out day, and then a well driller calls in and says, I need you at 3 o'clock to come conduct a grout inspection. Or a septic installer, I need you at 9:30 when I set the tank, and then I'm going to need you to come back after I get the rest of it done at 3. And those are things our staff have to work in on the fly on a daily basis. So it's a challenging job. Multitasking is an understatement for what our staff have to do. And then, of course, you throw in the weather, the fact that all of my staff, with the exception of a couple, have young children, and we've got schools and closures, and they're out sick. And I mean, it's scheduling's fun.
It's not as simple as making an appointment for 10 o'clock to 11 o'clock, 11 o'clock to 12 o'clock for another inspection.
That's correct. I can tell you I'll be there at 11. If my first stop, I run into a problem and I go over, then I'm going to be calling you to say, Mr. Irwin, my first stop, I got held up, ran into an issue that we had to correct. I'm going to be 30, 45 minutes late, and so forth the entire rest of the day.
Is there many applications going with taking the options? Are they waiting on you guys, or?
We're seeing quite a few more, but it's not dramatic. It's probably about maybe 5 to 10% district-wide that people are taking these other options. We have some people that apply with us and go with an LSS, and whoever gets there first. We get people that'll call in and say, hey, I want to withdraw my application, and then we've had others, that we get to before them. So it's still a very small percentage, about 7-8%.
Any other questions?
Thank you all for coming and explaining. I see several realtors here in the audience today. Has something to kind of work together. There's a lot of preparation that goes into it. Sounds
There's a lot of moving parts to, but in the goal, and I think the realtors and the builders and the installers will all agree with us. The goal is to get it done properly. I have seen firsthand what happens on when back in 2005 through 9, we ended up in Watauga County reevaluating over 300 permits because the work was questionable. And it was during a time when we were just as under pressured and not able to support our staff. So we want to do it right because that's what's going to keep people coming to our communities and staying here is in these second homes, or for a lot of people, they're moving here and they want to live up here. We want to make sure that all that is done right, so that 10 years from now, when the realtors are reselling the property, there's not a question about the septic permit that can then really, put off.
Bobby?
Is there anything that the board can do to help in any way? Is there anything that we can do? Is there anything the county manager can do to?
Got extra post hole diggers and augers at the office, fellas.
I was just going to say, if there's any particular concern about a property specifically, or one that you get a complaint about, we always want to try to come up with a solution. So make sure you point those back to us because we can help figure out what's going on. Use us. That's what we're here for. Andy and I are happy to try to investigate if you have a concern. Obviously, it's not our goal to have a complaint, but if you have somebody who's not feeling like they understand what the holdup is or anything like that, we're happy to look into that directly. And just know that we're continuing to move towards our goal. I mean, it's going to take us continuing to work with the state issues, with the workforce issues, and our own staff trying to retain them. But we are committed to doing it because we know it's the right thing. We know we've got to be efficient, and thank you for.
I think one thing that you said, I think right now we're really climbing that ladder with house sales and remodeling, but that's not going to continue forever. So you're trying to get these employees, but what happens when we start doing this and you've got a lot of lag time, for those employees? You just can't hire them today and fire them tomorrow.
Well, the questions, we certainly appreciate you guys coming and talking with us and bringing us all the good information today, and be looking forward to you coming back and give us another update.
Thank you. Appreciate it.
Next up's Finance Officer, Miss April Ham.
Did you report? This is our monthly financial report. Year-to-date revenue, $8,655,412.86. Year-to-date expenditures, $3,625,127.77. And our approved budget for this fiscal year for the general fund is $17,611,637. Year-to-date revenue is right at 49%. I'll just remind everyone that we've gone through a big month for revenues with tax office and citizens taking that discount in August. Expenditures is just a little over 20%, and we're a little over 20% into the year into the budget. Bank balance as of this morning, $15,155,341.75. Bank balance as of a year ago, $10,455,131.64. And then bank balance as of 2 years ago, on August the 31st, $7,824,331.44. Taking into account the net revenue and expenditures just for this fiscal year, our net financials as of this morning are $5,030,285.09. I have not included the fund balance in this report. We are in the middle of the audit. We should have those audited numbers in the next couple of months. It's due to the state by the end of October, so I will put that off till hopefully the next report for you. Any questions about that report?
It's great.
It does.
The next page, we've only received one allocation of sales tax as of this fiscal year. That sales tax and town taxes, things like that, stay a couple of months behind. But we did receive the July allocation, $93,679.92. And this time last year, when we received the July allocation, it was $85,415.80. So the trend continues up with sales tax.
Another good improvement.
Yes.
Another good improvement. Any questions? Okay. Move on down to the next Treasury, Department Treasury update.
Just wanted to give you a little update on the ARPA funds, the American Rescue Plan Act funds, or state and local fiscal funds, they're also called. We had one report that was due at the end of August, an interim report. We did have some technical issues getting that in. Michael actually went through the same process that I went through to actually request the funds, so they now have his left kidney. That's kind of an internal joke. They took my left kidney to get these funds because it was a process. And at the beginning of the process to start that report, it would not let me submit it. So they do have Michael's information and my information. So he went through the process, got through it, took about all day to do it, honestly. He tried to submit the report and it wouldn't go either. So we do have this report in as of today. It was a technical issue with the U.S. Treasury, new website, new portal. You got every county in the United States and municipality trying to submit these reports. So all is good. I actually checked it this morning just to make sure, and everything is submitted. Our next report is due October the 31st. We'll have quarterly reports from here on out, and we'll have to report what we're spending the funds on. I think there'll be another work session scheduled sometime in the near future to kind of narrow down where some of those funds are going to be going. I answer any questions?
Has the Treasury given the final ruling yet? Do we have definite rules?
We have a final rule, yes.
Praise the Lord.
There was one in May, there was one in July, and there has been another one published. So we have asked some questions about a couple of things, specifically the hospital and some of the other
I was on that
outside
session,
entities.
so I
Yep.
heard those questions.
Yep.
But I wasn't clear if they gave us a definitive answer on that.
It is going to fit in a category, and we have been gathering information from the hospital is what we've been doing on our end.
Any other questions?
The other questions will be for the work session then.
Appreciate it.
Thank you.
Thank you.
Thank you.
David Spicer, Public Works Director.
Chairman and Board, thank you for the opportunity to update you on these county properties. The courthouse, and I think Michael will have some information on that. That's certainly an ongoing project that we're still having some delays on as far as the roof is concerned. The Daymark building, we have been in the process of renovating that building after the mishap that occurred last December. We've had some delays in being able to get some products. However, the products have been delivered now, so the carpet's going in. That should be within the next week or week and a half completed. So the Daymark building should be back up and going. And then 90 South Main, that's a progress, a work in progress, and Michael will have some more on that here shortly on the plan of action for that. The admin building, the work for that, County Commissioner meeting today, so we're going to start the work tomorrow or Wednesday to finish up all the earthquake damage here in this building. The stairwell will start first so that people's aware. That will be blocked off, roped off, caution taped with signs made, and we'll still have the elevator that's available to go between floors. So that'll be the first plan of action, is starting with the stairwell. Work at Veterans Park for the additional displays, the Constitution, the Bill of Rights, and those things, that's underway. As you know, they met with us at the last County Commissioner meeting, and there's progress being made for that. So that's well underway. Our transfer facility, the new compactor is scheduled to be here the week of the 27th. So the last week of this month, we should be getting the compactor in for recycling. We'll have that up and running as quickly as we possibly can. Like I said, we've already got the pad poured. The power is there. Everything's ready. All they've got to do is bolt it down, hook it up, and turn it on. So we should be good there by the end of the week of the 27th, we hope now. I ain't going to say for sure that we will, because we can run into some delays, but that is the schedule for now. I've sent in emails for roll-off truck. I'm still waiting on a reply to discuss some pricing on that. Michael and I have been working together on getting that roll-off truck that was approved. So we're still waiting on that response. We're getting a lot of volume right now. Those guys over there at the transfer facility have been very diligent in their work to keep that place a lot more suitable than it has been maybe in the past, but right now we're getting a lot of volume. To give you an idea, we're sending out. Right now we're sending out between 150 and 200,000 pounds a day. So that's a lot of product that's leaving this county. So between 75 and 100 tons. Now the construction process that's been going on with some of these demolitions as far as earthquake properties has been concerned. We sent in for reimbursement for 672,000 pounds. Past that, now started counting over, so past that, we have now received 487,420 pounds just in the last couple of months. So that's 1,159,420 pounds of earthquake damaged materials that has come into the transfer facility. The loader the loader is not down, but the AC compressor's out of it. They've got to replace the AC compressor. We've got some universal joints that's giving us some trouble, so we're on top of that, trying to get that worked out with ACT, and they have already been and ordered the parts, so keep our fingers crossed that the parts come really quickly. They're still using it. It's just they can't shut it up and use it as efficiently as it should be used. because of the amount of heat that we've been having on days. So, but they're still using it. So I'll keep you updated on that so that you'll know where that is. So at this time, I'll answer any questions that you might have.
You had mentioned the roof at the old courthouse.
Yes, sir.
We're still doing, what's the progress, what's the holdup, or?
It's materials, and I think that's further down on the agenda that Michael will have some more information. He and I have kind of worked together, and he's been in contact with these folks. So he'll have the latest information just a little bit later in the agenda, if you will, sir.
Okay, thank you.
Yes. We appreciate you, David.
Sir, thank you.
We'll take a 10-minute break at this time. Go ahead and call our meeting back to order. Next up be 911 Grant Awards, Mr. Daniel Roten, EMS Director.
Oh,
Good news, huh?
Good morning.
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 It is good news. So I think most of you already know that we had applied, of course, for the 911 grant to try to get that facility updated and moved, and I think you're also mostly aware that we received that grant. $135,000 is what the amount of that actual grant is for. Now, I think the question had come up as to what's next, where do we go now? And so the answer is, I'm learning with you guys, and I don't really know either, but I'm going to give you all what I've been told, which is that there will be an MOA or an MOU that should be out to us by the end of the month, is what I've been told. Once that's signed and returned to them, we have to develop a work plan and a budget within 60 days. I don't know how detailed that is. From conversation I had with 911, the board, their regional coordinator, she's going to come up and sit down with us and kind of give us some guidance on, exactly what all that means. And I did ask the question this morning too. I said, well, now this grant, is it for fiscal year 22 or 23 or when is it? And she said, as soon as you get the MOA, you can start spending the money. So, hey, that sounds good. Now, the other consideration as part of that is, the grant award was for $135,000. We had identified costs of almost $350,000. And I want to be clear that, the grant will pay for the things that normal 911 funding will not pay for. In this case, that's the tower to be constructed outside and the renovation of the space. So the intention would be that the remainder of that balance is either paid for with our normal 911 distributions or what they call a funding reconsideration. And I asked the question as to, we really need both. We need the grant and we need the funding reconsideration to make this thing work. We can't really do without one or the other. And she said that the grant committee, who I reckon is also the people who approve the funding reconsiderations, was aware of our request or the fact that we would need that. And she said, I can't guarantee it to you, but it sounds pretty good that they'll probably approve your funding reconsideration too. And now that, of course, that extra money would be for other computers and consoles and chairs and all that other equipment that goes in a comm center that is way over my head somewhere. I'm learning as I go. But apparently there's a whole lot of stuff that goes into one of those rooms that with a normal 911 money will pay for. So as far as I know, that's all I have on that. Does anybody have any questions?
Chairman,
Good job, Bo.
Yes, sir.
Daniel, may I, to go along with that, that's the great news. All right, that's the great news. Maybe a real quick indicator on the FEMA side, because the generator is actually part of this process as well.
That's right. And maybe you guys remember, and I'm glad you mentioned it, that, I had applied for a generator grant some time back to kind of tag along to one of the disasters that happened down east. Well, the initial indication that I got last week was that grant would not be approved. And the answer I got, or the reason that I got, was they said, well, your facility needs to be completed before FEMA will consider it. My answer is, it's pretty hard to have a comm center and an EOC without a generator. So I'm going to figure out if there's some door I can knock on, some appeal I can make, some additional clarity. I'm not writing it off just yet, but I just want to make you guys aware that initially it doesn't look all that great.
Would that include the box and the wiring required for the generator?
Yeah, it was a generator and whatever it needs
And
to
the
function.
electrical connection,
Yeah,
okay.
that's right.
Good.
Now, of course, the 911 money will pay for some portion of a generator, the portion that is dedicated to that part of the building. So if you put it down the hall here, the 911 money would pay for, I don't know, whatever the percentage works out to of that power required to run that little space. So, we'll move forward with that and see how we go. I'm not done kicking tires yet. I'm going to see if I can get a little more clarity on that.
Oh, good work.
The committee that was tasked with doing that did the legwork, as to putting all those numbers together and putting all that work together and developing a package. And of course, it was great. It's the first time I think we've ever actually applied for that grant, and then to receive it. And then to also, I had a sidebar conversation with one of those 911 board members a little after I delivered the presentation to them. He said, I'm just going to tell you, man, they don't fund towers. They don't do that. So not only did we get a grant, but we got one for a tower too. So heck yeah. While I'm standing up here, I think the next item on the agenda was sort of as an update on the earthquake and where we're at with that. So I reached out to Dana towards the end of the week. Of course, you know the state's managing most of that for us. And I'm in the loop, and I'm trying to help and support, and we're all working together on that. So these are Dana's numbers. But residentially speaking, right now they have 116 total active projects, with the vast majority of those being in this county. Now, there are a few in other counties that, you know, were tagged along with that legislation. And they've made he says they've made payments on 52 of those that are occurring in Alleghany County. In addition to that, they've totally completed 114 projects here. So that's 114 and 116, it's 230 houses. Some of those are completely torn down. We haven't completed a rebuild just yet, not a home rebuild. Now, we did complete a mobile home replacement. The foundation was all, that is completed and done. I expect in the next month or so, we'll start wrapping up some of these rebuilds that are far enough along in the process. With that said, we've got another round of tear downs coming. David knows, you know, because we hauled a couple over to the transfer facility last week. The East Step property down here on 21, you guys saw it come down. And there's a couple more that have been identified as very likely to realistically need to be demolished and rebuilt. So we're trucking right along. We're still moving in good. The campers at the fairgrounds have served their function very well. They were all full. Actually had a family move out. They had a smaller repair to their home. They moved out, but I'm getting ready to put somebody right back in it. So they're booked up and, like I said, doing what we need them to do. So I certainly entertain any earthquake questions at this time.
Just comment past the rock house down here at Little River where y'all took all that down. It looks real nice.
I don't know what the plan going forward is for those other properties there, because they were, you know, secondary properties. So we'll see how that goes. I think it's public knowledge at this point that now that house, where that house was at, is county property now. They accepted a buyout, so that'll be something for the county to look at going forward too.
Yeah, but we can't sell it. We got to keep it, right?
The problem is it's restricted in its use, and that's in the deed, so there's very limited uses, and it would have to be another nonprofit or something, so I don't know if it would make sense to try to sell it to anybody else because it's so restricted that you can't do anything with it, so it has to remain open space, and the DOT in the widening of 21 would have the ability to take more of that property too, so there's some restrictions, so I don't know ultimately what any use could be possibly for the property.
It's just a hole right there between the buildings and everything else, so, okay.
So close to the river that you're getting down into the floodplain, you know, if you go back that way, and then you're getting close to 21 if you come out the other way, so.
Not be river access, fishing access? I mean, something along those lines?
Go fishing.
Yeah.
Are we
Just
continuing,
fish over.
are we getting additional damage from aftershocks?
At this point, it's kind of hard to identify, you know, is it new damage? Is it old damage? We're sort of at that point with it. We are still, of course, finding new things all the time. Dana tells me that he's getting phone calls from people he didn't know, you know, a month ago. So
Last time I spoke with him, he said that he was getting, he was investigating reports in Surrey County.
and some in
all
Wilkes.
over.
You know, they're everywhere.
Couple things. One thing, the grant that you got was a great deal. Appreciate all the work that you put into it.
Thank you.
The ABC store, they've taken the siding off I guess, the west side of it. I was told they found earthquake damage there. Do you know anything about that?
I haven't been made aware of anything.
Okay. And
Who owns that building? The building? Who owns the building?
the side of the building, they were going to put up some type of mural, so they took off some of the siding. When they took that off, they found these cracks. I don't know if it was earthquake related.
We'll certainly have a look at it.
That was just, it's something from the mayor, I don't know.
Okay.
The other thing is that I've talked to several people that have dealt with the earthquake people from Raleigh, and they've been nothing but very pleased, very positive. They said they were the great people to work with.
I've received the same comments. It's actually kind of troublesome to get around town with them because now everybody knows them and they like them, so I can't get anything done anymore.
They're local celebrities.
That's right, that's right. Well, they are nice folks. Not heard nary complain about them. Any other questions?
Thank you.
Daniel, we appreciate you. Thank you. Veterans Park update, Cole Edwards, Parks and Recreation Director. Morning.
If you remember, I think last month came and asked for funds to improve the track at Veterans Park. That should be completed the end of this week. The gentleman's already laid the milling down, pressed it once. He's going to bring his roller back and press it again. It's a huge improvement. I've spent the past couple of weeks down there getting soccer fields ready. And soccer actually started this past weekend and had nothing but good comments about it. Nothing negative said about it, but just wanted to update y'all on that.
Any questions? Thank you.
It's good. It's getting there.
Next courthouse roof update, Mr. Michael Carter, County Manager.
We've talked about it a couple times already, and normally we sit in here and we say that we're still working on it, and we rattle off a few thoughts about it. Today, I am happy to say that I have more than just that update. As you all know, in dealing with this particular project, there were a lot of hoops to have to jump through because of how it has been designated. And unfortunately, it's not as easy as tearing it off and replacing it when you have to go through some of the historic requirements when you're looking at these projects. So for about a year and 3 months, we've been talking about a roof on that courthouse. So we're about 15 months deep on this thing. And I got to the point where I quit talking about it because I didn't want you to think I was just saying something to say something. But I can tell you that our engineers, which is REI on this particular project, they'll vouch for you when you talk to them. I will say that the heat was turned up on them over the last 2 weeks because it's just been long enough. And we've already awarded a bid. So we got together this past week with the project manager for the contractor who has the award. His name is Robbie Helms with Tecta America. And he and 2 of the engineers from REI and I had a conference call. And at that time, as David Spicer alluded to, there were some difficulties in finding all the materials. You know, you could find a roll here, you couldn't find the fasteners there, and it was a kind of a pick and choose kind of meshing. Now, we did talk about alternatives to the roof, which quickly got squashed because that would have done nothing more than added additional time to it. But miraculously enough, over the last couple of days, we were able to locate all the materials, all the fasteners, all of the necessary roofing components to now begin this project. And on Thursday of this week, we're actually having a pre-construction meeting to top that thing and get it going. So in my conversations with the contractor, once they get everything on site, once we get the laydowns, we get everything taken care of, we're looking at the most of about a 2-week project. And more likely, weather permitting, of course, anywhere from 7 to 8 days. Now, I've been assured that, and David Spicer will appreciate this, I've been assured that we don't have to take any other special precautions. Anything they tear up or tear out on that day, they will replace and put back, so we won't have, any type of damage, additional damage occurring. But I am happy to say today that I do have an update worth mentioning, and with everything intact, I don't see a reason why this project shouldn't be completed before mid-November. Now, we talked about some temperature. This material has to have certain temperature levels to apply it. And most of those revolve around 40 degrees or higher. So that only added fuel to my temperature gauge when I indicated that it's very quickly going to start getting below that. So once we have that meeting on Thursday, I'll have a better understanding of when we anticipate to start. I'll send an email out accordingly, but I'll update you also at your October meeting, and hopefully within the week or two following, they'll be on site and ready to make that necessary replacement. Happy to answer any questions that may arise from that.
Anybody? Sounds good. Move right on down to the 90 South Main.
90 South Main is a little bit different. As everyone is aware, back in August of last year, we had some engineering companies come through. I think Daniel was part of that kind of assessed some of our facilities as well as some of our residences and structures. And I believe the appropriate terminology at that time, Daniel, was they did a windshield kind of review because of the many out there that needed to have, some vision. That's went along. There's been different thoughts and comments on the 90 South Main facility, enough so that I brought to you a couple of months ago an additional agreement to bring on R&D architects to further look into that facility. At this point, I have a summary. I do not have the full reports, but I am prepared to share that summary with you at this time. So basically what we have at this time is R&D actually came up and performed an on-site visit on September the 14th, so not long ago. They contracted with Kessel Engineering. I think I'd sent a memo out saying that you were going to see a drilling rig set up there. So Kessel Engineering out of Mooresville actually brought that rig up, and they did soil borings around that facility because there were questions about the soils and the compactions and all of that. There were 2 locations on either side of the facility that they looked at, and these are all preliminary again, and I don't want to say these without indicating that, but there was some substantial fill around that facility. On one side, there's at least 9 feet of uncompacted fill at that facility. And as could be imagined, that it settles. And then when you have twisting and shaking and all these conditions that the earthquake has brought along, it hasn't helped any. So there is some continued looking at some of the fill material. And you could see that. If you walked up to the facility and looked, you could see some settling, you could see some ground disturbance, you could see some cracks visually. So that's expected. They also did an initial investigation of the interior of the facility. And I don't know, I've already been called out by Commissioner Bobby Irwin that a lot of times I use this, well, that was before me, so I'm going to use that again. But when this facility was constructed, they went in and looked at the internal workings of that facility. There was also some things that they identified and pointed out. And it ranged from some of the attachments of the beams to some of the modifications When the construction occurred, I'm not quite sure that building inspection was actually in Alleghany County, just to be honest with you. So, with that in mind, I just want to point out that some of these findings, findings, but they are going to put these into a more detailed report that I will be able to share with you, hopefully, at your first meeting in October. But there are some substantial findings. And as a result of those findings, I will read you a couple of things. They don't question the stability. I want to make that known. They're not questioning the stability of the facility. But there are considerations on the addition. And as I remember, the addition was built sometime after the initial construction of the facility. And right now, I have asked them to give me the 3 possibilities that go along with that addition, because at this point, the addition is what is in question. And they are going to, first of all, they're going to confirm their initial findings of what I've identified briefly. And then they're going to look at what it would take to bring that addition up to current code. They're going to look at how they could look at possibly removing that addition. Or finally, look at removing that addition and then rebuilding it back. So you're going to get 3 ideas. And as we continue to move forward, I will certainly keep you updated on that. We have, again, I want to say there is no concern over the facility falling or collapsing or anything of that nature. But these findings certainly generate concerns on how it was originally constructed and how we go about making the necessary repairs and or removing that addition from that facility. That's all taken place over in the last couple of weeks, and as far I'm satisfied with what they have given us, and I'll continue to update you accordingly. Be happy to answer any questions that I can.
None of this is earthquake related, or is it?
That will be determined. It has certainly been a contributor. Yes, sir.
Is there any alternative? It doesn't sound expensive.
Not in the paperwork I have, Commissioner.
Positive, it's structurally sound.
Walk in and out of it all day. There are just some questions about techniques used initially and what that has resulted in due to natural settling as well as earthquake urged.
Shake the info, good update. Put on down. What else? Update, Commissioner Bobby Irwin.
Just, I guess, a brief update on what's been going on with the community center that's going to be turned in, or it is now active, second courthouse. It's been used quite a bit here in the last 2 months, I believe, and there's a courthouse committee, and that consists of myself, Susie Gamble, Michael Carter, David Spicer, John Irwin, and Drew. And we've been meeting, I think we've had about 5 meetings as to what we're going to have for a opening ceremony or a grand ceremony. And that right now is scheduled for October the 22nd at 2 o'clock. There's been a few changes made since the committee got started, and John's planted a bunch of flowers, and there's a bunch more to be planted, and David's done some stain work and painting and bush trimming and just trying to make the place look nice. But I think everybody could hold that October the 22nd open, 2 o'clock. There'll be more information coming at our first board meeting in October. I think it's going to be a very nice facility. We still have upstairs to consider what to do with it. But one thing I'll say to the other commissioners is, when this committee was formed, I just envisioned we were looking at the new courthouse, but it's taken on a different role as to the old courthouse, the parking, handicap parking, judges' concerns, the sheriff's concerns, maintenance. So it's turned into it's an enjoyable committee. I've really enjoyed it, and I've enjoyed the history that's come out of this. So just, like I say, mark your calendars, and we'll hopefully have a new flagpole down there, and we're going to have a sign. It'll be the Annex Courthouse. That'll be what it'll be designated as. So just look forward to seeing everybody then. Any questions?
Thank you, Bobby. Good update. General business, Cole Edwards Fairground application, revised application.
All right. I think this was also about a month ago. I had provided y'all with an application and asked for your concerns. This revised copy is what we have discussed here, and as well as the steering committee. I don't know if y'all want to go through this page by page, or if you just want to give your comments or any questions that you have on it.
So the requested changes were made.
Were made and
board
approved by legal.
Board wish for him to read that, or just, Bobby, got a question?
A couple of comments, and I guess some questions for Cole, is looking at the fairgrounds fee schedule, and I may have missed it someplace, but on the old fairgrounds, there was a price for using the tractor.
Correct.
And I don't, am I missing it on this one?
No, it was taken off here for the time being. Mr. Carter can correct me if I'm wrong, but we had a discussion in our steering committee about not making the tractor available for people to use. If they use it or want to use it for an event, then it would be operated by somebody on the fairgrounds committee. So that's why that's left off there.
Due to liability concerns.
Correct.
Liability insurance.
Correct.
Okay. And I at one time I think this is basically a contract that we would be signing. And in the past, I've asked that there be a clause in any contract that the county signs that if the party who's may violate something, that there be a clause that they would be responsible for attorney fees if that was so designated by the court system. Something, there's a general catch-all, reasonable and amount of attorney fees if we had to go to court. I think that's something that should be in all of our contracts that we deal with any part of the government. That's just a comment. And I don't know what's happened at your steering committees, but have you all talked about who gets charged and who doesn't get charged to use the fairgrounds? Has that been brought up yet?
I mean, we did internally, but I mean, I think we decided that here amongst the board as well, if I'm not mistaken.
We did, the board decided that? I must have missed that part of it. Do you know when we decided that?
When y'all gave me your suggested changes and concerns on the application.
A month ago, that was over.
That was about a month ago.
About a month ago, yeah. Yeah.
I'd just like to check on that or revisit it. I'm curious about the health department. I'm curious about educational programs that are put on. You know, there's no use to charge somebody if the county government has to put it back in their budget to use it.
I think that was the consensus of the board. Was,
yeah, I'll just, if there's a list someplace or.
The educational uses, I know we talked about specifically because there was communication with Amy Lucas and that there are no funds within their budget to allow for this. So it would basically be the county giving her the funds to give back to the county. Right. And then I think from a previous, and I mean like a year, no, maybe not a year, but months ago, understanding from the board is that the health department had access to it at any time if the need came up. And I'm not aware of any charges or anything that was applied to them for, the clinics or any of that nature.
Well, I'm just curious about even an educational event, somebody's bought the sawdust, somebody spreads the sawdust, somebody has to get rid of it. What's the responsibility? Does that fall back to Cole to do that? The event holder, are they responsible? I must have missed that meeting.
Anybody using the facility still has to fill out an application. So, I mean, in the application is a checklist, so it still has to be returned in its same state that it was given in. So, I mean, they're still responsible, even though they're not having to pay, they're still responsible for picking up after themselves.
Even if it's an educational?
Even if it's an educational.
They're still responsible for cleaning?
Correct, yes.
Okay.
Yeah.
That's all.
Was everybody satisfied with this new application?
Do we need a vote on that, Mr.
I think
Chairman?
we do, don't we? Yeah, need a
I
motion.
make a motion to approve the application, sir.
Got a motion, I'll second that. Any further discussion?
The question being about the legal responsibility. If Ms. Klein thinks that needs to be added, I'm in favor of the motion.
You want to add that in?
I think that's a good idea.
I will modify my motion, subject to inclusion of the legal clause
Legal
discussed.
Okay, he modified his motion. We got a motion and a second. Any further discussion? Not all in favor? Be 4-0. Thank you, Cole.
Thank you, sir.
Number 2 is Glade Creek, which they're not here. We canceled that out, so we'll move on down. Performance and evaluation criteria. April Ham.
Morning again.
Morning. Afternoon.
Yeah, that's right, it's afternoon. What you have in your packets
Nick.
is kind of a condensed version. The evaluation will actually look like this. It's on a legal, so you have more room for comments and more handwriting from the department head or supervisor, whoever is completing the performance evaluation. We've been working on this for probably about 4 to 6 weeks. This is a totally created internal document that we did. The employee portion of it has 14 categories. The department head will have a separate evaluation, and there's 15 categories for the department head one. I know this is kind of sideways here, but there are 5 categories across the top. Each has a value assigned to it. Unacceptable, needs improvement, average, good, and excellent. So when a supervisor or a department head goes through the process with the employee, there's a value put there at the end, the total. And then when you go back to the end of the evaluation, there's a total score there that's going to be divided by how many categories you have. So the raise will be a percentage of that whole 1 point. And that will calculate, and you can see that raise percentage right there. That's where it'll be calculated. So everything is set up for the department head or the supervisor just to put in each category, what the score is, and it will automatically come up with that. If you remember in the budget, we had 1% budgeted for the 1st of December and another percent budgeted for the 1st of May. So we'll be doing this twice this year. Or this fiscal year, we'll be doing it twice. On the employee version of it, the employee will sign, then the department head, and then it will go to myself as the HR officer and then to the county manager. And we will review it. On the department head one, it'll just be department head. Of course, Michael's the supervisor for the department heads, and then I will also sign it at that point too.
I think you need to review your verbal communication under the employee communication.
Mm-hmm.
Listens purposely to understand and learn what others have to say. Conveys information using vocabulary, spelling, grammar, and punctuation clearly. Now, I admit I do this, but it's usually whenever I'm talking into my phone. I don't think that the vocabulary, spelling, grammar, punctuation needs to be in there on that. I'd remove it. It's a minor comment. It looks familiar. I do like the way that you have put goals and improvement plan on the back so that if anyone gets a 0, there is a requirement that you tell them where they're deficient and what they need to do to improve, correct?
Yes.
Thank you.
We would anticipate everybody should have some type of goal at the end of it, no matter what the score is. We should have a goal there.
Sounds familiar.
Anybody else? Yes, sir.
May I respond to Commissioner John for just a minute? Unless you want to, April.
Oh, you go right ahead.
Okay.
We actually had this discussion just a little bit, so.
Okay. I understand what you're saying about verbal. I get that. And I say this with a smile. One, we're not evaluating commissioners. So let me point that out first. Secondly,
I take it you would have a negative column then?
well, there are 5 columns. So what I would identify is, since I've been here, we have had different reports that have been provided from employees. And some of those are, very, very well written. They're legible. They have, they leave little doubt about the wording that's been tried to be used. And there have been some that you kind of had to guess what words that were being used and in what context. So as a growing for our employees, we are encouraging them to broaden their vocabularies and incorporate grammar skills so that we can present these. We have to present some of these reports to the state. We have to provide details to our attorney from time to time. It's not that I entirely disagree with what you're saying, but I think the expectation of having our employees communicate in those fashions, I think, is a plus.
But you covered under written communication.
Those are 2 different ways.
True, but I guess I'm just not getting it. If I tell someone that they need to remove their cranium from their rectal orifice, do I then have to say with an exclamation point?
I have to draw a picture.
We're verbal and written. It's minor, but,
We will accommodate.
Now, I will do that whenever I'm sending a text over my phone with the daggone voice recognition. As a matter of fact, I find myself leaving a voicemail saying, comma, exclamation point, things of this nature. And I'm not the only one because, but it's a minor point. I do like the evaluation. I like the way you put it in. And do we need a vote on this? Before we started talking about how many angels we can put on the head of a pin?
I think during the budget process, the concept was approved.
Yep.
But it was requested that the criteria be presented to you for your review and comment. If you are okay with this format, then I would ask you to consider a vote on it, because we can now implement it. We can provide the training to our department heads on how they are to conduct these things, and we move forward.
I'll make that motion based on the reconsider the verbiage under verbal communication.
Got a motion to hear a second.
Second.
Motion and a second. Any further discussion? Not all in favor, raise your hand. 4-0.
Thank you.
Thank you. Next up's phone internet discussion. Mr. Carter.
Mr. Chairman, members of the board, you know that we have talked about this for a couple of times, and what I would like to do today, we have, I guess as of this weekend, Ms. Ham, we have interviewed for our IT position that was included in the budget. And we received confirmation this weekend that the selected candidate is going to accept the position. Now, this individual is employed in another position away from here at this point, so I'm not disclosing any of those details because they have to have communications with their employer, etc. What I will point out is this individual has a very impressive resume, not only in internet understandings, availabilities, and operations, but also voice over IP, telephone systems, etc. There were acronyms used in that resume that I still haven't deciphered. So I would like to allow that individual to come on board. I would like to present those proposals. You have an email from the consultant, but I would like for that individual, with the experience they bring, to also review those proposals so that when we consider them, we will be considering them from all vantage points. So if acceptable, I would ask that we table that at least until your day meeting in October.
I would see no problem with that myself. I mean, we went on for a good while here.
Well, I would recommend, Mr. Chairman, that we notify the bidders that we are going to delay, the reason why we are going to delay, so that they are not left out in the dark.
I agree with that. Motion.
I will make that motion, Mr. Chairman.
I'll second that. Any further discussion? All in favor, raise your hand. 4-0.
Mr. Chairman, if I may, as a general comment, I was fortunate to where the county manager allowed me to view the applicants, and the one that has accepted, we have a gift from heaven. She has international experience with international companies, and if you wrote a wish list, she would meet 99.99%. Believe me, she is impressive on paper. If she's half as good on paper as she is in the actual job, she will walk across New River without benefit of the bridge.
That's good. Moving on down, budget transfer request, Sheriff's Department, Ms. April Hand.
This request is actually kind of a result of delaying the IT person on board. The Sheriff's Department needed to do some maintenance to some communication equipment and had some things already in process in the law enforcement center. Michael has reviewed it. He actually had a couple conversations with Nick about this request. So I have this before you. It's from dispatch salaries, $2,230, going to the maintenance of communication equipment in the dispatch center. And then from law enforcement, full-time salaries, $3,495 to law enforcement computer expense.
Motion.
I have some questions,
Okay, go right ahead.
Mr. Chairman. We know that they are using Windows 7. Is this money going to upgrade so that they can bring in an up-to-date? Windows 11 came out this weekend. What are we spending this money on whenever we're sitting there and we're wide open?
I don't have those in front of me, and I don't know if April does, but these are past due. These are items that were held over, is my understanding.
Part of them are held over, and part of them, a couple of them were in process, I think.
They do not include, I do not believe, any software, 7 to 10 or 11 improvements. What they are is the technical support that they received on their other systems, as I understand it.
That's what I understand as well.
You say technical support, but we are sitting with a Cisco system that is out of date, has been identified. Our software is...
Do not disagree with you again, but what I would counter to say is we are taking the steps with this new position to help provide a resolution to that particular concern.
It is going to cost us money. Somewhere down the line, whenever we bring these systems up to date software-wise, and we aren't identifying it, but I hope our new IT person doesn't come in and see how backward we are and walk the devil away. I mean, we were lucky enough where you took on the challenge.
We have her strategically located in this facility where there is no exit code, if that makes you feel better.
Chain her to the desk. And just for the public's knowledge, we are nobody has updated our systems. We are operating our 911 center on Windows 7, which they quit supporting 5 years ago. Same with the Cisco. So this is what we're talking about. We are deficient. We've got to come up, and that is one argument with over the budget that I'm going to argue with you, Mr. County Manager, because I know whenever you start messing with your budget, you get defensive, but this is something we've got to take care of. Thank you, Mr. Chairman. I would agree.
Mr. Bobby.
Is this something that needs to be done ASAP, or
These are past due bills.
can't wait till the IT person comes on?
These services have already been provided.
Oh, yeah.
Do I hear a motion?
So moved.
Second. Any further discussion? All in favor? Raise your hand. 4-0.
Thank you.
I think the IT person's going to have their hands full.
I hope so.
Amen.
Well, I'm thankful we've got such a qualified, I know nothing about it, but just what I've heard is she's very well qualified, and that will be a big. Moving on down, discussion of recent notification of 3 properties for the National Register of Historic Places.
I don't mind to lead that discussion. I have in your packet, beginning on page 18, a letter that I received 1st of September identifying 3 properties. It is from the North Carolina Department of Natural and Cultural Resources. I'll just read the first sentence. We're pleased to inform you that the proposed downtown Sparta Historic District, which includes the above referenced properties, will be considered for nominations to the National Register of Historic Places. And those properties are 12 North Main Street, 30 North Main Street, and 85 East Whitehead Street. Now, I have went through this letter. I've went through the supporting 5 fact sheets that are attached to this letter. A lot of this letter, a lot of these facts on these 5 fact sheets pertain specifically to privately owned facilities. These 3 are not privately owned facilities. So when you're reading through it, you know, you go to fact sheet 1, it talks about privately owned. You go to fact sheet 2, and it's all the same. Now, again, I'm gonna use my cards again, just for Commissioner Bobby's enjoyment. I made a comment to him earlier that I don't really know how these properties got designated as historic here. I have printed off the comparisons of what the National Registry is to the local designation, so I understand those. I don't know if all the criteria that is listed under the local, I don't know if that's in effect. But what I do understand is perhaps this was led by another organization with good interest in mind. And I believe, as I have looked through it, I believe the SRC, and at their time of existence, may have had some understandings and dealings with this. Now that that is under the Chamber for Economic Development's umbrella, as I understand it, I believe it would be a good thought for this board to invite the Chamber to your next meeting on first night meeting in October and have them provide you with some feeling behind this. I mentioned earlier, you know, there are certainly benefits, there's recognitions, there's designations, there's a lot of things that go along with this. I just want to make sure that it's been followed correctly and that we know what we have and what we are about to be designated for. Because there is provisions within this packet that allow up to October the 15th to submit questions or objections should that be something that we need to entertain as well. So my recommendation on that would be to table it to your first meeting in October and ask the Chamber of Economic Development to be present to provide information needed to make a better decision on it.
Mr. Chairman, I'll make a motion that we table the request until October 1st meeting.
A motion to table
Second.
and a second. Any further discussion? All in favor? 4-0.
Could I ask a question here,
Yeah, boy.
Mr. Carter? Is the old courthouse, what's it designated right now?
I do not know the exact answer. I know it is a local. I know that is why we went through what we went through for the roof, as an example. It very well could be listed nationally as well, but I do not have that information. I called the numbers that are included. I could not get a response. I have sent an email asking that, but I have not received it back.
I just, for the last many, many months, we've talked about the old courthouse and the hoops that we've had to jump through about repairing the roof, the extra cost that it's costing, the delays that have been involved. That, I just thought that building was already a historical landmark.
And I will go back to one of my sheets. Again, this all, and it may be just the way it's written, but when you start looking at the fact sheets that were provided with this letter, and I'll read out of paragraph 2 of the page 18, it is the second sentence. It says, listing in the National Register places no obligation or restriction on a private owner using private resources to maintain or alter the property. There's nothing in there that talks about a public owner. So I think my opinion is we need to know, because these are publicly owned facilities, process is, because if it was privately owned, you pretty much could do what you wanted to. Publicly owned, I'm not so sure about that. And I don't want to put our attorney on the spot, but I don't know if you have any dealings with this as well, but anytime I see a separation between privately and publicly identified in the first part, but I see no comparison of publicly throughout, that gives me concern.
What buildings are these three buildings?
The courthouse, it is the new court facility, and I don't know the appropriate name of the small one-room building adjacent to the courthouse, but I understand the Alleghany News may have used to been in it.
Alleghany News used to be there, and that was
Rufus
Mr.
Dalton's first office.
Yeah, Mr. Dalton's office also.
That would be my take. Nothing trying to delay it. We have a month to address it. I just think we need more information.
Okay, we got that tabled in until October, first meeting in October. Next up is the Miller.
No.
First, before the consent, we've got the request for campground vacant lot solid waste fee releases. So I'll just go through those if you don't mind. The first one that you have is Snowdrift Lane. It is not in a particular campground, but it is a site that has been used for a camper. Folks sent back the information and said that they have not had any type of camper, mobile home, things like that on the property in 20 or 21. So they're requesting a release of that $98 fee on that lot. So what we did with this was create this form, request for release, and where they state and sign that they have not had a camper on there, and then it also talks about that it's their responsibility, and if we find later that we can go back and charge that $98 plus any fees or penalties. So that's how we did that request for release, and we explained that when they turned these in as well.
The recommendation is?
We didn't find anything saying that this was, that they had anything there, so I guess I would recommend that we do release this particular one, yes.
Okay. Motion?
So moved, sir.
Second? Second. Motion second to release this. Any further discussion?
Just a question. They're saying that they didn't utilize the land with the camper.
Correct.
Does that mean they didn't utilize the land with a tent or anything else? Or how is somebody that owns a house that doesn't use that house it's their second house, and they don't utilize it for a year, they just let it sit vacant? Are they treated, Can they ask for this also?
They can, and then it's up to the board whether or not they approve that. Currently, I think if they have water and sewer hooked up, typically the board does not release that. In prior years, we've had it if you stayed there one night per year, it didn't get released. But more recent boards have been power and water had to be completely disconnected before they would release the solid waste fee, and unlivable. The campers, it's a different, whole different ballgame when it comes to the campers.
Got a motion and a second. Any further discussion? All in favor, raise your hand. All opposed? 3-1. Excuse me.
Second one is another campground solid waste fee. This is 225 Saddle Ridge Drive. David Triplett, he says that in 2021, there has not been a camper located on their parcel for one or more nights.
On the board,
Motion to approve.
motion and a second.
Second.
Any further discussion? All in favor, raise your hand. All opposed? 3-1.
Second one is just a parcel out in the county, not in a particular campground. They did send a letter in saying they do have a camper on the property, but they do not reside there. Maybe a little confusion on the explanation to them about what the solid waste fee would be, but they do have a camper on the property that they use on occasion.
May, Mr. Chairman, ask a question?
Yes, sir.
So if they're storing the camper there, not utilizing it, so that they can drive somewhere else to use the camper, is this what we're looking at on this particular incident?
On this instance, it is a camper here. They do use it on occasion. And so that's the type of things we were looking at during the budget when we started talking about the campers and the solid waste fees. And was it generating garbage within our county?
Well, it concerns me, Mr. Chairman, the people that we had during the public comments. The campground is shut down half the year. To me, it's reasonable to meet their request for $49 a year charge. And it would apply here. If they use it one night, you cut it in half, but we're going to be.
I'll tell you what worries me about that scenario, and I understand what you're saying, but you got a lot of houses in Alleghany County that's here less time than that, and we never hear anything. Just saying we got to set the bar somewhere or something, and think about the whole situation all the way across the county. Because, yes, sir.
To interrupt you when you're finished. I just want to point out that we had a discussion about these campers and we did all that. Not call anything, but at that point, which was in this fiscal year, the vote was to assess that fee regardless, if it was 3 months, 6 months, 9 months, 12, and that's what we've been doing. So if that's a consideration or something you want to revisit, wasn't the same idea you had when we adopted it.
People that have a summer home that may use it 3 months out of the year or 2 months out of the year, they're still creating trash. It doesn't matter. Some people live here, one person lives in a house for a whole year. They may not create as much trash as somebody that lives here for 4 months, 4 or 5 people. A transfer facility is expensive, and the more people that pay for it helps keep that fee down. whether you're a camper, whether you're a house. To me, like it'd be an impossible task on your part to find out who's here 180 days, who's here 150 days, 200 days.
Do you just do spot checking to,
We do, and that's why we brought this up, either, all campers or none, because it's impossible to police campers. But the campgrounds do get reviewed at least once a year, and we also use our pictometry program for that.
The gentleman that spoke said that he was being charged by the campground for refuge. I believe, if memory serves me correct, and it may not, but he said that the campground was collecting $2,000 from all of the units that are there. Then the county's coming in and collecting $18,000.
I'm not mistaken, that's going to be their dumpster.
Their dumpster. So there's a means of providing the refuge there. If we have a charge for a campground based on the number of units that are in there, and charge the campground, let them collect from the campers, then that takes the onus off of us.
is that dumpster the private service, private contractor dumpster, right?
I would presume.
Yeah, I would. So they're
The
paying-
county hasn't got
They're
anything.
paying the private service factor to do that.
And then we should be charging the private service whenever they dump in our transfer facility. So,
A dumpster fee is a separate fee from the county's
yeah.
$98 fee. Almost all businesses have a dumpster fee. You can't start splitting these fees up just because you have the option to have a dumpster. That's a private business. That's not the county's business. The county is running the transfer station, $98 a year.
But do we not charge whenever that private enterprise comes in to dump? We charge them, don't we? If they're dumping for free, you what?
Yes, sir.
We do.
No, we do not. They're dumping for free.
Let's go back to our problem here at hand. These people can use that camper at their leisure, right?
Yes,
Anytime.
yes. They have said that they do, they just don't reside here full-time, so that was their concern.
But it
The
says
camper's still
here,
hooked up.
it says here that there was not a camper located on the parcel for one or above 9. These people did, so it's gone against what they've already,
They don't meet the
I
requirements.
think we
they
deny
didn't meet the
this.
requirements.
I would agree.
My thoughts exactly on this one.
I make a motion that we do not approve this.
I'll second that motion.
Motion and second, any further discussion?
To not approve.
Not approve it. All in favor? 4-0.
Yeah, it's just a general question.
Sure. Sir.
Rita, you may be able to help me. This one says, we do not have or ever received an address. Why would they not have an address?
I don't know what the requirements are to get an address from 911.
Some of the other ones do. That's-
Those are in campgrounds, these are all in Saddle Ridge Campground that have the address. Yeah.
Find that out.
It's a big difference from the one we just voted on and the others, because
They have stayed there.
they have got the ability to go live in that camper.
Right.
If they want to disconnect it and pull the camper out, I think that's a big factor myself.
I do think there's going to be some differences. There are people, folks at Saddle Ridge or any of the other campgrounds who may own 2 lots, one for the camper, one for extra parking. And so for the extra parking, no, they should probably not be assessed the solid waste fee. We don't know that until they come and tell us. And that's what the thing says, it's going to have to be something they're going to have to be responsible for reviewing annually and let us know.
But, Mr. Chairman, we have brought up something that we need to discuss in the future, and I'd recommend that we put it on the agenda. The private contractors are not being charged to dump their trash in the transfer station. Now, they are making a profit on it, or else they wouldn't be in it. And here's the county We're sucking it up $56 a ton so that they can provide a service and make a profit on it.
That goes back to a conversation we had about the structure and fee structure. For whatever the purpose, there are these yardage fees and there's these different things out there that we're going to improve and we're incrementally making those changes. In your next budget cycle, I don't think yardage fees should even be a component. And wherever that thought came from, I can't configure it because you can take a yard of styrofoam peanuts and you're not going to have a pound. You can take a yard of slop out of a restaurant and you might have 3,000-4,000 pounds. But you're going to, the fee applies the same because you're charging on yardage.
So if you've got a private trash collection business, they're being charged yardage? Are they
Some
being
cases.
charged something?
In some cases, but again, me, I'm a straight tonnage. That's how we pay to get rid of it. That's what we ought to be collecting to receive it.
Okay.
This situation, it's been set up for however many years, and David and I have wore each other out over this thing, but that needs to go away.
Mr. Chairman, I believe that's subject for a work session in the future. Would you agree, Mr. County Chairman, Manager?
I would, but keep in mind, it's going, whenever you make these changes, you know, the sky's falling because suddenly these collectors are going to have to do their businesses different. And I don't mean to sound insensitive, but we need to do ours differently, and there's going to have to be an adjustment.
I realize that, and I'm willing to take a heat, but prior to the start of the meeting, I was talking to a lady there. She's on Social Security. That is her total income. Her husband has passed, and she's being charged these fees, and she's only up here 2 or 3 times during the 6-month period. So is that fair? And we look at someone that is operating a business and dumping, and we aren't even charging? I think we need to discuss this one a little bit more, and I would recommend that we do. Thank you, Mr. Chairman.
Yes, sir. Go ahead, Rita.
Next one, 219 Saddle Ridge Drive. This camper, they stated that it had had major water damage and it has been taken in for repairs. It has not been there, nor will be this year.
They plan on taking it back next year?
If the repairs get completed, then they'll put it back on next year. And on these, what we plan to do in our system is it may be released this year, but it's going to be back on the bill next year. And it'll be up to them to, it'll be up to them to go through the same process.
Motion to approve, Mr. Chair.
Motion second, any discussion? All in favor? Raise your
What's the
hand.
motion? Approved.
Approved, and it goes back on our books next year automatically for the rest of this year.
Because the camper was in repair?
It's gone for repairs.
Usable.
Understand? No.
All in favor? All opposed? 3-0. 3-1, excuse me.
Next is a request for residential solid waste fee. This is a house at 181 Moxley Hollow Road. A previous board had approved a release on this one, and it got put back on during the revow process. So I would recommend that the board release
So
this.
we're rectifying a mistake.
Correct.
Motion to approve, Mr. Chair.
Motion and second to approve. Any discussion? All in favor? 4-0.
Next one, 28 Prather's Lane, same situation. That's an old house that had previously been approved. During the revow field work and data entry, the solid waste fee got put back on.
Deal was the last.
Motion to approve, Mr. Chair.
Motion and second, any further discussion? All in favor, raise your hand. 4-0.
And not on the agenda, but I do have some late applications for elderly exclusion. Will I need to save those for next time? Okay. All right. I'll just pick all that back up after the meeting, and I will bring those in next time. Solid waste fees are, they're not easy, but have a good day. Thank you.
Thank you. I think it's a good time for a 1-hour lunch break.
Got your consent agenda while Rita's here.
Okay, all right, good deal. I thought she was ahead.
Forgot that too. Any-
Mr. Chair, I've reviewed the consent agenda. I have no questions and will make a motion to accept as presented, sir.
Okay,
Any questions, if you have any?
we got a motion. Do I hear a second?
Second.
Any further discussion? Not all in favor, raise your hand. 4-0.
Thank you.
Thank you. Now,
On-time airlines.
it is almost 5 minutes to 1. We meet back here at 2 o'clock to resume our meeting. We're in recess till 2 o'clock.
Thank you, Mr. Chair.
2 o'clock.
That was pretty close.
Yeah.
I'm pretty proud of that.